Hello everyone, I'm Victor Narejos from Barcelona, Spain. Thank you for so much for being here. I'm coming from the International University of Catalonia, from the restorative department, and today we are going to talk about flowable injection technique. That probably you know this technique, and it's a recent and trendy technique in dentistry, and I'm going to explain you a little bit how was the story and my protocol to try to do it as good as you can. Always I want to introduce this part from Google, that it's Google Trends. Google Trends it's exclusive website from Google that you can see all the trends, all the best moments during the year, during the same day, during the different countries. And why it's important that because you can see what the people is looking for. So what does it mean? That the people has some kind of interest in that particular topic in that particular moment. And why I want to introduce you that, because you can see this deep technique, it's, as I commented before, really recent and really trendy. So probably most of you knows about this technique. I don't know if you apply it or not, but this technique it's something that it's trendy because it improves a lot and you can obtain good results. This technique was described in 2014 by Douglas Torrey and John Powers. They published two articles, part 1 and part 2, about this injection technique. That means using flowable materials to restore as a definitive restoration. In 2017, Douglas Terry also he published a book about just talking about flowables, how to manage and how to select properly the case for this kind of material. And I really recommend you these 3 lectures. But the main purpose from Douglas Terry and Powers was to present a technique that can simplify the process. You know that doing a freehand restoration it can be very complex and also can be very skill dependent. So with these materials you can try to copy and paste the mock-up or the the trying that you choose for the patient. So it can be precise and predictable and simplified method to reconstruct and to recover the original shape of the patient or a new one if it's demand, while we reduce the chair time. So as I comment, for example, this patient she presents to the clinic because she has a little bit of tooth wear and interiors, and with just one silicone guide that we are going to explain how to select and how to do it properly, this silicone guide, just with one shade and with one material we can recover this anatomy in a fast and predictable way. That's the main goal, no? Just try to obtain the best results, all of us, independent of the skills of all of us. So I recommend you, it's a trendy technique, but it's not has to be just trendy, it has to be proved by literature. So since 2014, that is when this thing was presented, we can appreciate that a lot of articles are published about that, were published about that. A lot of cases were describing this technique, and a lot of evidence was published also regarding this topic. For me, the most important articles talking about this technique are these 6 ones. You can see the original ones from Derry Douglas. You can see also new ones in 2018, 2021, taking and doing a summary, the advantages and disadvantages, how to do also this technique in a conventional and digital way, and what are the main characteristics of this restorative materials to do this technique. So for me, we need to create a protocol, and this is my protocol I want to present you. This is 5 steps protocol. The first one was diagnosis, then following by treatment planning, how to do and select properly the silicon to do a silicon index, then the main part of the topic, that is the injection technique, how to do it, and finally the finishing, polishing, and maintenance for this. The first thing that we need to understand is that the case selection is critical. Why is critical or crucial? Because we need to know the limits of this technique, and we need to know the boundaries of these materials. Because if not, even you have the best material in the world, but it's not properly selected the case, it's gonna fail. So we need to know that. Which are the pros of this technique? It's time efficient because it's a single appointment. Normally you can manage these cases in one appointment. It's minimal invasive. Why? Because we are trying to add, due to the material that is flowable and it's resin, we don't need to prep most of the cases, and we need just to add. That's all. Then it's predictable, yet it is. Why? Because we try to copy and paste the mock-up that we already tried in the patient before. And also, due to its resin, it's reparable and reversible. What does it mean? I didn't touch the teeth, and if something happened, I can repeat or I can repair. What doesn't happen with the ceramics? Why? Because in the ceramics, you know that it's an indirect process that we need to send to the lab, and we probably, if something happens, to redo completely the veneer or the crown or whatever. About the cons, the treatment alternative. What's next? The people think that this technique is a treatment alternative. It can be. It can be for sure. It cannot long last as the ceramics, but I don't think that it's a temporary restoration. I think it's a long-term restoration or definitive restoration, but it can be understand that it's not the best material in the world, so it's not gonna long last 20 years, for example. Also are related with the material limitations. The color, normally it's just one color, and it can be monochromatic because the color of the material can block a little bit the color of the substrate, but not always. And also it's the longevity of this resin, it's not the same as the ceramics. So my indications are, in purely additive restorative cases, it's extremely prediction when you need to correct a little bit the shape or do a small close of the diastemas. Otherwise, if you try to do big diastemas closure, it's not recommended because you cannot control the maintenance profile. In developmental defects, why? Because MAH it's not the best patient in the world, because you can normally deal with young patients that you cannot have the adequate time to treat, so it can be a fast solution, very convenient. About mock-up, you can do this technique just for a mock-up or for a long term temporaries, because it's the best material in the world just to polish, better than a bisacryl. And also in short term temporaries. Why? Because this material is so strong and it can be more stable in mouth compared with soft resin temporaries. Regarding treatment planning, we know that we need to try to send this information to the lab, or just to recreate the reality that is the natural tooth in the conventional or in the digital way. Okay, what does it mean? Then we have the typical alginate or polyvinyl siloxane impressions that we need to pour in stone, or we can do this protocol with digital workflow. I did in both workflows. Okay, what happens? We have pros and cons, as always. It's true that the naturality or the texture or whatever that we have in the conventional workflow is completely different that we have in the digital world. But what happens? The digital allows us to work faster. We can do a mock-up and wax up in a faster way compared with the conventional. Then we can select different libraries. Yeah, different libraries means different two shapes, and you can choose the ideal shape for the patient without investing a lot of time. And also we have the possibility to produce different models. I will explain this with this case. Imagine that you have this case with some teeth wearing lower anteriors, and she wants to restore these incisal edges. What we did is, first of all, we took a digital impressions, and with these digital impressions we did the wax up. Okay, we did the wax up. What the digital technology allow us is to create different models. Why? Because I don't want to splint or to fertilize everything together. I just want single tooth restorations. What does it mean? I want contact points. So I can produce one model, do first one restoration and not in the adjacent tooth, and then do the other ones. In that way, also I have a good interdental stability. What it's important that, because if not, I can have some kind of discrepancies, and my incisal edge probably it's gonna be more higher than I want. So in that way, doing two models, I have an interdental stop in the middle. So in this case is what we did. We do one tooth, not the other one, and one tooth, yes, and treat it with orthophosphoric acid, adhesive. I did the flowable injection technique in one of them, then I'm micro polishing, checking the contact points, and then I finish the other ones. That's the reason why in that kind of cases it's super easy and faster for me work in a digital environment. You can see in a single appointment we can restore the incisal edges of all of them. All the cons are, there are some cons, and the main cons are due to the model, the texture of the model, and the marginal definition of the model that is related with the 3D printer and the 3D printing process. So in that part, we need to know that. But even with that, if I put in a balance that my pros are higher and better than my cons, so I always try to choose in the digital workflow. What I need for the digital workflow, I need a digital internal impression, yeah, and then some kind of pictures, especially if we are talking in the anterior superior area. I really need a full smile picture. If it can be a close-up, it's better, just to have the relation between the mouth and the lips, and if it's possible also one picture full face with cheek retractors. This allow me to do a correct wax up following the aesthetics that I want and following the dynamic and the lip position. Also, we can do a fast simulation nowadays with artificial intelligence. Okay, just with one picture of the patient, we try to select the tooth that we want, and the software can give us a very natural and real purpose to do the wax up. With that, we can do a fast wax up and show to the patient. And the power of these new technologies is that just with one picture, one single picture, remember that we just would talk one single picture, we can do this wax up in 5 minutes. And also we can set to the software, please, you can generate like a video, and you can see with this picture the artificial intelligence, and they can do this video and this simulation for the patient. Anyways, the mock-up that it's obtained from the WhatsApp that we did in the computer, I did it and I tried always, especially in the purely aesthetic cases. And I tried with the same restorative material. Why? Because I want to inject flowable composite, so I want to prepare and to do this in the flowable material that I'm going to use to check the color, to check everything. Regarding the silicon index, we need to do this silicon index with some kind of trace. Why? Because this silicon, as you can appreciate, and if you use it before, you know that it's not hard, it's not soft at all, but it's a gelatinous consistency. So we need a tray to put the silicon in. For that, you can use the stock trays that can be very convenient because already you have the shape of the mouth, or you can create a custom tray from by yourself. It's important that both trays has to be clear, completely clear, okay? Just to see where is your silicon. So imagine that you want to do a custom tray from the WhatsApp, or especially from the duplicate of the WhatsApp, or from the virtual model. Yeah, you can create a normal silicon index. With this silicon index, you do like a vacuum or a Essex tray, and you can maintain the stops in the posterior area. Once you have these stops, you can put again this clear silicon inside this tray that you did. Okay, but the problem is, okay, Victor, which kind of silicon I should choose? Should I choose? There's a lot of silicons. It's true that not all of them are equal in terms of mechanical and visual properties. And I wanted to show you this article published in 2024 that they compared 4 types of silicon and 4 types and 4 different thickness of its silicon. The important thing that we can obtain from this article is that not always the most translucent silicon that it's Exoclear. Exoclear is like the gold standard in terms of translucency and light irradiance. Why? Because it's super clear, super clear. But what does it mean that being so clear is not super strong? So my point of view regarding when I need to choose one or the other one is just to take the green and the red dots of each one and then put everything in a balance, and for example know why or for what do you want this silicon. What does it mean? If you want this silicon for the posterior area, I want a very strong silicon because I don't want to press and deform my silicon and my material inside. So the question is not which is the best silicon, is this what do you need for. Yeah, because as you can see, you can obtain a good parameters through the silicon. It's true that exactly it's the closest silicon to the no material, let's say, but after all, you're gonna light cure a little bit with the silicon in mouth, but then you're gonna remove the silicon and light cure again. Another important thing is it's true that the thickness is super important. So if you have a small thickness, you can deform the silicon. The light pass excellent, but the silicon is completely deformed. The important thing is to choose an appropriate material that allow us the light going through, but maintaining the consistency and the modulus of elasticity of the silicon. And also an important thing is to have my light cure, to have a good one, a good light cure unit, and to have it clean, just to guarantee the best polymerization of the material as possible. Recommendations about the silicon index. always that you can do a custom trace index, or if not, you can select this stock trace. If it's possible, put the silicon, the tray, and the model while the silicon is setting inside water with pressure, because this silicon is gonna be better, is gonna fit better, and the adaptation of this silicon is gonna be better. And then, if it's possible also, before doing the silicon key, try to place the silicon cool inside in one place that it's gonna be cool. Why? Because if you put in the silicon inside the fridge 1 hour before, 30 minutes before, this silicon is gonna work slower and you have more time doing the silicon index. Regarding the technique, first of all, it's impossible to do full isolation. We need to reach the gingival area, so we cannot do this kind of complete isolation. I strongly recommend just to place a core, a retraction core, or if it's possible, a Teflon or PTFE core inside the sulcus. Why? That's the reason, just to avoid the saliva and the clavicular fluids going to the tooth. We can maintain with that. And if you then doing the polishing touch the Teflon, doesn't anything happens. Okay, so like in that case we just place a Teflon core inside the sulcus, we did the injection technique, and then we repolish that. Regarding the adhesion is not the best in the world in that area. It's true. Why? Because there is no enamel, probably it's just dentin or root, and also we don't have a full isolation. So what we recommend, just to clean everything with airborne particle abrasion, that's true, just to clean and remove all the debris, but just apply acid to etch the most part of the tooth but not reach this gingival area. Keep 1-2 millimeters away from the gingival area. In that way you can guarantee that the gingiva doesn't start to bleed there. Like in this picture, just protect the adjacents and try not to reach the gingival aspect. Okay, and this is something related to a good article published by Lorenzo Brecci, that he compares the etching the full surface and adhering the full surface against etching just one part, and then believe in the cervical aspect to the adhesive that the cement has inside, and they observe that the definitive values are quite similar. For that, it's important that you have a good acid, and that means that it stays on place. So you need high viscosity etchants. And regarding the adhesive system, I normally recommend to use universal. Why? Because are very convenient, just one step, and are very polyvalent for this kind of restorations. So normally this is my protocol. I etch the enamel 30 seconds with orthophosphoric acid, and then I apply an adhesive that normally it's universal. Regarding the restorative materials, these restorative materials are mainly flowable, no? Because are materials that we can use in an easy way and adapt in all the surfaces. I work with all of them, yes, and there's some pros and cons. Probably the most typical and the most known for this technique is the from GC, but nowadays I work with this brand. It's a Spanish brand, Normon, and I think this restorative material is very convenient because it has a perfect consistency. You can see the consistency of this material that looks like a packable material. So it's important to know that, because the manipulation of this material, it's it has to be good, just not to have a lot of excess. Normally what I want for that, it's a good color, good looking, and normally it's between A1, B1, or even the bleach color. Yeah, but this is something that the patient has to choose. And then an important thing is the opacity. The opacity, it has to be a good enough just to try to mask as much as you can, but depends for sure of the thickness of this material. Regarding the tips, I strongly recommend a long tips with metallic end, because in that part you can reach the gingival aspect and avoid to have a lot of excess during the injection process. And it has to be fixed in the silicone, because if it rocks a little bit you have even more excess. Finally, once you don't have done the technique, you obtain something like that, a lot of excess in the ancestral part, interproximal, gingival aspect. So what we need to do, first of all, just improve the shape, let's say, with some disc, and then break the contact points with metallic strips. But this part, it's important that you do it slowly and not reaching the gingiva. Also, if you need, you can pass these metallic non-serrated strips just to break and polish and remove all the excess. But after all, when you have everything with the contact points good and everything, you can go to the gingival aspect just to polish and obtain a good polishing of this part. Also, you can choose a polishing system that it can be easy to apply. For me, I normally use this from Norman also. These two caps, one is for polishing, one is for finishing. And it's really convenient, because two caps, you obtain a good glossy surface and you don't need anything more. And then if you want to clean a little bit more, you can use this brush with some kind of alcohol or something like that, just to remove all the dust that you have after the normal polishing.